You are scheduled for penile implant surgery and want to know how to prepare for the day of surgery? This video is for you. Hello everyone, my name is Jonathan Clavell, urologist and penile implant specialist. When planning for penile implant surgery, the biggest step that you take is making the decision to get the surgery done. But what happens next? You had your consultation with your surgeon, got your questions about the surgery answered, and now you find yourself wondering, now how do I prepare for the actual surgery? Once your decision is made, there are many things that need to happen in order for the surgery to be performed. Let's talk about the most important questions that need to be answered prior to your surgery. Number 1, do I need cardiac clearance? Clearance is a common term used in surgery that refers to a doctor's evaluation to ensure your heart is healthy enough to safely undergo a medical procedure or surgery. One very important factor that we as surgeons need to make sure is that you are healthy enough to undergo surgery. In the hands of an expert, a virgin implant tends to be a procedure that is relatively quick and can be performed in less than 1 hour. However, when undergoing anesthesia, be it general or spinal anesthesia, we need to make sure that your heart is healthy enough to undergo anesthesia. Therefore, it is important that you discuss with your surgeon to see if you need medical clearance from a cardiologist to undergo surgery. In some occasions, that clearance letter needs to be accompanied by the last progress note or any pertinent diagnostic studies, be it an electrocardiogram, a stress test, or an ultrasound of your heart that prove that your heart is actually healthy. Does everyone need clearance? The answer to that is simple. No, not everyone needs clearance. Generally speaking, if you are younger than 55 years old and have no medical history of heart problems, you may not require clearance. But if you are older or have had any medical conditions with your heart, like a heart attack, chest pain, an irregular heartbeat, etc., it is very likely that the anesthesia team will require some sort of clearance. If you are older than 65 years old, we advise you to obtain medical clearance from a cardiologist to make sure your surgery doesn't get inadvertently canceled. Sometimes the heart rhythm may be irregular, and even if you do not have any previous heart conditions, having that clearance will prevent any surgery delays or cancellations. If you do not have a cardiologist, you can let your surgeon know, and I am sure they can recommend one for you, even if you're coming from out of town. Therefore, remember to ask your surgeon if you will need cardiac clearance for your surgery. Number 2, do I need to stop any medications prior to surgery? In general, you may continue most of your medications. Be sure to have a list of your medications when you go see your surgeon and discuss with him or her if you need to stop any of these medications. Generally speaking, medications that may need to be stopped prior to surgery include blood thinners and the GLP-1 agonists. There are many different types of blood thinners and some are stronger than others. How long before surgery do you need to stop the blood thinner is something that you should discuss with your surgeon or the doctor giving you the clearance for your surgery. You may be wondering if you need to stop aspirin prior to your surgery. Well, that depends. There are many of us experts that are okay with patients taking aspirin during their surgery, or sometimes even some of the stronger blood thinners during the surgery procedure. But even if your surgeon is okay with you staying on that blood thinner, it is still something that we as surgeons need to know to prepare for your surgery appropriately. Therefore, remember to discuss with your surgeon to see what he or she recommends for your specific surgery. The other group of medications that are important for us to know about prior to surgery are GLP-1 agonists. You may know them as semaglutide, Ozempic, Trulicity, Wegovy, Victoza, etc. These medications have grown very popular now to help with diabetes control and also for weight loss. If you're wondering why do these medications affect my surgery, well, the way that these medications work for weight loss is by delaying how quickly your stomach empties. That means that your stomach takes longer to empty the food content and stays full. Therefore, if you have a full stomach the day of surgery, this may put you at risk of having complications with anesthesia. Generally speaking, these medications should be stopped 1 week prior to surgery, although these depends on several factors which include, number 1, what you're taking the medication for, be it diabetes or weight loss, and number 2, how long you have been taking the medication for. The delay in your stomach is more common when the medication has been recently started versus those patients who have been taking the medication for a longer period of time. And number 3, what are the rules of your local anesthesia team? For example, some anesthesia doctors are more conservative than others. Therefore, some might require for you to stop the medication 1 week prior, others 2 weeks prior, and others might suggest that you keep a liquid diet for 24 hours prior to your surgery. I am certain that your surgeon can help guide you on what to do if you're taking any of these GLP-1 agonist medications. Let's talk about medications you do not need to stop taking. These include prostate medications, testosterone, and daily dose of tadalafil or Cialis. You heard that right. If you are on testosterone, generally speaking, you do not need to stop taking your testosterone. Prostate medications that are taken to help you urinate do not need to be stopped, as well as daily tadalafil, also known as Cialis, of 5 milligrams or lower. Quick reminder, please do not take a full dose sildenafil or Viagra or a full dose Cialis the day of your surgery. This will not enhance your erection or improve your outcome in any way and can affect your anesthesia. If you take a daily dose of tadalafil that is 2.5 milligrams or 5 milligrams, you may take it the day before surgery and restart the medication the day after your surgery. If you take blood pressure medications, we recommend that you take those as prescribed. If your blood pressure is too high the morning of your surgery may be canceled. However, if you take your blood pressure medications at night, do not take them in the morning with the intent to lower the blood pressure even more. As always, discuss with your surgeon or their team, and I am certain they will help you with these. Pre-op question number 3. Can I use my vacuum pump leading to my surgery? Absolutely. As discussed in previous videos, the vacuum erection device can help stretch the penis tissues from the inside out and help maximize your size the day of the surgery. For details on what regimen I recommend, go to our video titled How to Maximize Size Before, During, and After Surgery in our YouTube channel. If wondering when do you need to stop using the vacuum pump, I generally recommend to stop using the vacuum pump 1 or 2 days prior to your surgery to avoid patients from arriving with a bruised penis the day of the surgery. There is absolutely no need for you to vacuum the morning of surgery. For example, if you're traveling to have your surgery done with a surgeon who is not close to you, do not carry your vacuum in your luggage. You may leave it at home. Question number 4 regarding surgery. Do I need to do anything or stop doing anything the days that are coming up for my surgery? Here's a list of 9 recommendations that I have for my patients leading up to penile implant surgery. Number 1, arrange for transportation back home. When undergoing anesthesia, we do not recommend you to be driving that day. Therefore, it may be wise to have someone come pick you up. Not possible? Please discuss with your surgeon's team what options you have available to get you back home safely. Number 2, bring loose-fitting clothes for when you leave the hospital. You will wake up with a big, bulky dressing and a partial erection. Loose-fitting clothes will be easier for your trip back home. Number 3, if you do not routinely shave or wax your genitals, do not shave yourself. Shaving yourself can lead to bacteria growing in your skin. A skin infection may lead to your surgery getting canceled. We can shave you when you are under anesthesia. Number 4, shower with Hibiclens soap. Hibiclens is a soap found in most local pharmacies that contains chlorhexidine, which is a strong disinfecting soap commonly used to sterilize and prevent infections. I recommend to start using it 1 to 2 days before surgery and the day of the surgery before coming to the surgery center. A total of 3 days. Concentrate on scrubbing the genital area. You do not need a prescription for this soap. Once again, this may be found over the counter in most local pharmacies. Number 5, if you do not have regular bowel movements, I recommend using a fleet enema the night before your surgery. This will help empty your rectum, which may help reduce inflammation in the pelvic area. If doing it the morning of surgery, be sure to shower afterwards with the Hibiclens soap one last time before heading to the surgery center. If you have regular bowel movements, you should be okay without the enema. Number 6, we will try our best to, prior to your surgery, provide you with all the medications that you will need for after your surgery. This way, you do not need to pick up anything after your surgery. If you're coming from outside of the state of Texas, we will probably need to wait until you are in Texas to get your prescriptions ready and sent to your local pharmacy. So do not worry, almost everyone will get their medications prior to surgery. Number 7, start your antibiotic the day before your surgery. There's an antibiotic that you will start the day before your surgery. This may vary depending on your drug allergies and any prior resistance to certain antibiotics. Take the medication the day before surgery. Do not take it the day of surgery because that day we will administer stronger intravenous antibiotics. Number 8, for the day before surgery, remember to not eat or drink anything after midnight. That being said, I would highly discourage anyone from eating a big, heavy meal the night before surgery. Try to eat something light and healthy. specifically if you're diabetic. Do not eat a high-carb diet like a big bowl of pasta, for example, because this will increase your blood glucose the following morning and may put you at a higher risk of developing an infection or even getting your surgery canceled. Number 9, and last but not least, try to relax. We know you are nervous. The day before surgery, I would recommend you to do something that will help you be stress-free. Be it watching a movie, taking a walk outside, read a book, anything that can help you be calm for your surgery. We understand that you are nervous, but if you chose right, trust that your surgeon has your best interest in mind. In summary, there are many things that are needed to ensure you will have a safe and effective surgery free of complications. Do you need medical clearance? Do you need to stop any medications? Does your surgeon have any specific instructions you need to follow? Make sure you clarify all of these things with your surgeon's team to avoid delays, cancellations, or unwanted complications. Wonder what will happen the day of your surgery or after surgery? Be sure to watch our YouTube videos that go into depth of what to expect the day of surgery and after penile implant surgery in order to better understand how to optimize your recovery. Have more questions? Be sure to put these in the comments below and we will do our best to answer them in future videos. We wish you the best for your surgery and we hope that you have a swift recovery. Thank you.